Welcome back, everyone. September, Prostate Cancer Awareness Month, and about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. Grateful this morning. Dr. Vijai, an internal medicine physician with ProHealth Physicians in Glastonbury, here to talk to us all about it. Dr. Vijai, thanks for being here.
Thank you for having me. Yeah.
Prostate cancer is something that we hear a lot about, but maybe we don't know a lot about it. So what is prostate cancer exactly? And perhaps more importantly, what are some of the symptoms we're looking for?
Okay, so it's a good thing you mentioned that. So prostate cancer is basically an infection in the prostate gland, which is a gland that only men have. And it's very insidious, slow growing, and can be very tricky to diagnose. So the fact that you mentioned symptoms, that's essential, because one of the big symptoms that men will notice with prostate cancer is a change in urinary habits. So let's say you just get up once a night to go pee. If you suddenly happen to notice that you're getting up 2 or 3 times a night to go pee, then you should definitely be contacting your PCP to get checked for prostate cancer. That's a big hallmark symptom change. Now, if you happen to have a few too many beers at night and happen to get up 3 or 4 times to pee, that's not prostate cancer. So just to make that distinction.
All right. I am alcohol-free, doctor, so I don't think I have that problem.
Good for you.
I'm kind of hovering in this age range. So I just turned 42. My social group is saying, like, hey, do we get tested at 40? Do we wait till 50? What if somebody in our family has had an issue? Talk to us about when we should get screened.
Okay, so prostate cancer screening has changed a lot over the last decade or so. We used to do the dreaded digital rectal exam, which we don't do anymore routinely. So now we rely on a test called a PSA, which is a blood test. Like we discussed, change in urinary habits is the first thing. If you notice a change in urinary habits, contact your PCP immediately. Normally, most PCPs will routinely check your PSA at a young age, around 40, to establish a baseline. And then as the years go on, we will check it routinely, and if we see a significant change, that is an alarm sign, and we will act on it, get you to a urologist for a biopsy.
So to some of my friends my age who might be wimps, it is not as invasive as it used to be, nothing to be afraid of here.
Absolutely not. That's one of the biggest messages I would like to get across. We do not do digital rectal exams. We do blood tests to monitor your PSA and symptoms.
Talk about how we treat this. Is it treatable?
Yes. So ProHealth in general has very good relationships with our specialists. So our urologists are excellent. So normally the way it would be, you would have to go see a urologist, you would get a biopsy, then you will get staged and graded based on what type of cancer you have. There are many cancers, prostate cancer in specific, which is very slow growing and not fatal. So in that case, people with prostate cancer, depending on their stage or grade, will just be monitored for the rest of their lives.
And I like to leave people on the couch feeling empowered. What can we do from a prevention standpoint to do our best to maybe avoid this altogether?
Just stay healthy in general. Exercise, drink plenty of water. Prostate cancer, just like many of the other cancers, we don't cause, like lung cancer, for example. It's just something that you might genetically inherit. So just to be vigilant.
Some good information, Dr. Vijai. Nice to have you back on the couch. We're glad you're here this morning.
Thank you. I appreciate being here.